Hello everyone, I'm Dr. Pracha Eamranond, Chief Medical Officer at Doctorpedia, and today I have the pleasure of introducing Dr. Madeleine Biondolillo. Welcome, Madeleine.
Thank you. It's wonderful to be with you.
So, Madeleine and I go a ways back. Madeleine is a primary care doctor, but she's had so many different roles and titles. She was Public Health Commissioner in Massachusetts, which is how she and I began to interact. And so, Madeleine, can you just tell us about your journey and how you got into what you're doing now?
Yeah, thank you so much. Well, first of all, exciting that you're leading this effort. I think it's wonderful that doctors are coming together to share their knowledge base and their passion for keeping people healthy. How I came to the field of healthy aging and looking at the research involved and what the innovations are is really what you said. You know, I was a primary care doctor practicing in Massachusetts for many years, taking care of adults and older adults, the geriatric population, as best as we tried in my practice to ensure that people stayed healthy, didn't have to go to the hospital. It was largely successful, but not always successful. And when you need to go to the hospital, you need to go to the hospital. And we have wonderful stories about how hospital-based physicians are saving lives all the time and returning people to their health journey. But as we know in America, it's largely a system of care that's focused on when people get sick. So the concept of healthy aging is really about how can we keep people being people and not patients.
Right. So, just as we were discussing before, you've had a really amazing set of experiences in quality and safety and other realms within healthcare. One thing that we're really seeing quite a bit is the rise of immune disorders and their impact on health. So can you just let our audience know how you got into this world and what you're doing now to help address this as it relates to healthy aging?
Well, I think it's fantastic that Doctorpedia brings together physicians who bring their clinical expertise and, as I said, their passion for what they see as areas that could even be better to make sure patients stay healthy and patients remain people. For me, watching the practice members that I oversaw and my own patients who I cared for years really need to have an approach that was preventive instead of reactive or waiting until people get sick, taught me that no time like the present for looking at where there are opportunities to improve health. We know that autoimmune diseases, for example, are on the increase. So we're talking about things like diabetes, type 1 diabetes, inflammatory bowel disease, multiple sclerosis, and other conditions which are very variable. So somebody having inflammatory bowel disease is quite a bit different than somebody having, for example, type 1 diabetes. But there is a common issue, and that is the immune system is over aggressive against the patient's own body, the patient's own cells. And we think that there's a combination of factors going on which may be amenable to improvement. Certainly, avoiding environmental toxins is extremely important. But even things like the diet, and we've been talking a little bit about the research approach to precision nutrition, looking at the components of all of the person, including their genetics. What is their microbiome like? What is this intestinal flora, these intestinal organisms that we now are learning have so much to do with a person's health? And how is that contributing to their inflammatory status? Which means, how is the diet creating a circumstance in which the immune system is responding by attacking its own healthy cells?
Right. So there's a lot to unpack here, particularly with nutrition, with environmental exposures leading to autoimmune disease. Can you give us a personal or a patient story about, how we can prevent autoimmune disease or manage it?
Yes, great question.
Yeah.
So I was just saying that, among the conditions that are really on the increase for a variety of reasons include diabetes, and we know that some of that has to do with lifestyle factors and some of it has to do with genetics. We talked a little bit about multiple sclerosis. So as an example, this is a condition that does not affect a huge number of people, although for every single one person that it does affect, it's profoundly difficult to manage. But I'll give you an example of a patient who was 27 years old when he, an otherwise healthy young man, was diagnosed. And we're very fortunate now because we have a number of medications called disease-modifying therapy, DMTs, which really, in most instances, make a huge impact on multiple sclerosis.
Yeah.
Doesn't always work.
Mm-hmm.
So there's a physician in Iowa whose name is Dr. Wall. And Dr. Wall is also a patient, an MS patient, and years ago treated herself by creating an anti-inflammatory diet. It's called the Wall's Protocol. So there are patients, MS patients, including the one I'm talking about, who have gone through this extremely restrictive diet. Basically requires the person to be in a constant state of what's called ketosis. And it's not the keto diet that's designed to help you lose weight, although there are significant similarities. The purpose is to stop the immune system inflammation and decrease the symptoms of the autoimmune disease, multiple sclerosis.
Yeah.
This patient, 27 years old, had profound improvement by just being on this diet. And that's an example of how, even though the medications didn't work for this patient, the diet made a huge difference.
Right. So I'll have to editorialize, having worked at Up to Date for some years, which I highly respect and I think is really revamped medicine. There's only so much that modern medicine or evidence-based medicine can address. Diet is not one of these things that has a huge potential, but we're probably never going to get to the level of clarity around what diets can do because the randomized trials that are, relatively expensive and challenging to do are not being performed like they are with drugs. So if you go to Up to Date, and I can tell you from personal experience, as we were talking about, my nephew was just diagnosed with MS. I've got multiple patients, including doctors, just diagnosed with MS this year. And, I've gone on to Up to Date to look, and a lot of it is based on drugs, right? And they've been amazing, but they're clearly not everything. So really, I think understanding digital health, how do we bring forward this kind of information to the public efficiently and effectively is really important. So it really is, an honor and to have you, sharing your expertise with the rest of the world and really bringing this to life. Thank you so much.
Thank you very much.
Our Dr. Madeleine Biondolillo, who is our founding medical partner and is creating the Healthy Aging channel as we speak, which should be released later this year. Thank you very much, and we really look forward to seeing all the things you have to teach us in the future.
That's a great pleasure. Thank you, Dr. Eamranond.
Thank you.